Fiji is an island nation in the Southwest Pacific consisting of more than 330 islands, of which one-third are inhabited. As of 2017, the total population of Fiji is 880,000, and in 2020, the proportion of urban and rural populations are 60% and 40% respectively, with an overall trend of internal migration from rural to urban areas. According to Asian Development Bank, 25% of the population lives below the national poverty line in 2019, and the incidence of poverty in rural areas is twice of that in urban areas. Out of all the people who are defined as living in poverty, around 62% live in rural areas.
Now onto the health system in Fiji. The Fijian Ministry of Health serves the entire Fijian population under the 4 main divisions and 21 subdivisions. There are 3 main divisional hospitals, 18 subdivisional hospitals, more than 80 health centers, and 99 nursing stations in 2014. Subdivisional and divisional hospitals provide comprehensive services like core specialist services and serve as teaching hospitals for nursing and medical students. The number of staff per health center ranges from 2 in rural areas to 20 in cities, catering to on average 3.5k people in rural areas and up to 10k people in urban areas. For isolated areas, healthcare services are also delivered by free area hospitals, which have smaller capacities with no more than 15 beds. The majority of the medical workforce concentrates in urban hospitals, contributing to the shortage of medical workers and specialists in rural areas. The situation is exacerbated by emigration of healthcare workers to other countries.
The ratio of health workers in Fiji is around the absolute minimum set by WHO, with 228 health workers for every 100k people. Representing 2/3 of its workforce, nurses are the backbone of Fiji healthcare system. Nursing stations are usually the first point of contact with the healthcare system in rural areas, while these only take up less than 1% of the total health expenditure. There is typically at least 1 registered nurse on call in each station at any time of the day, catering to a catchment population of between 150k people. In our research, we have identified 3 main problems that we aim to provide solutions and improve the current situation. First and foremost is the physical distance between island villages and healthcare facilities. Remote islands, such as Gloria Island, do not have any healthcare facilities due to the smaller population, and villagers have to travel by boat to nearby islands for healthcare supplies and services, which would be more than 45 kilometers away in Fung Sze. Secondly, the incentive of COVID PCR testing is rather low, partly because the testing fee is expensive compared to other countries and regions. Moreover, early detection of cases is less effective due to the lack of an online reporting system for citizens test positive in a rapid test. And hence, we introduced the FIPHER project. We aim to achieve 2 main objectives. First, to modify CareFiji app to improve early case detection and efficient contact tracing. Second, to distribute prescription drugs and medical supplies through vending machines. Ultimately, we hope to lessen the inconvenience of accessing medical supplies and services in rural areas.
First, we propose to modify the CareFiji app. The use of the newly modified CareFiji app will be made mandatory. CareFiji was launched by the local government in April 2021. It is a contact tracing app that utilizes Bluetooth Low Energy technology to record encounters between 2 devices. It also has a QR check-in and check-out function. In addition to the existing features, we would like to add an online reporting system as well as an e-consultation function. If the result of the rapid test is positive, a photo of the result should be uploaded to the online reporting system immediately. Afterwards, the app will automatically notify close contacts who are identified via contact tracing. The notifications will request close contacts to perform rapid tests as soon as possible and report via the app if they are tested positive. This helps to increase the efficiency in identifying and informing close contacts. At the same time, infected persons will be given access to book an e-consultation session through the app. During the distance clinical consultation, medical practitioners will determine whether hospitalization is required based on their symptoms. Healthcare workers will also provide professional advice on the quarantine arrangements and provide medications if needed. A one-time QR code will be sent to patients via the app for collection of medications at the nearest healthcare vending machine. This feature not only avoids overburdening the weak public health system, but also solves logistical constraints and connects global networks of healthcare workers.
Additionally, vending machines can be installed in designated locations in rural areas, such as churches or community centers, to improve accessibility to medical resources. Special vending machines will serve to provide healthcare supplies to rural areas to make resources more accessible and convenient. These vending machines can be used to hold testing kits to promote early detection and containment of the infectious disease causing the pandemic. Materials for basic hand hygiene and sanitation such as soap, disinfectant wipes, face masks, and condoms. And lastly, medication which will be pre-packaged. Video screens can also intermittently show advertisements in order to generate revenue to help partially fund and maintain the vending machine. One vending machine will be located indoors and allocated for every 100 people. In terms of logistics, citizens can use a unique code from the telemedicine healthcare app to retrieve medical supplies as well as medication prescribed by their doctor that is stored inside the machine. For prescribed medication, patients will also need to present their national identification card to a card reader to confirm their identity before retrieving their medication.
In terms of how to implement our solutions, here are 4 developmental stages to our project. In Phase 1, the initial 6-month period, preparations will be done for app development and vending machines. We will contact the Ministry of Health, who were the original developers of the CareFiji app, and collaborate with computer science and medical university students in Fiji National University for adding telemedicine elements to the existing mobile app. Vending machine companies will also be contacted to design and order the machines. In Phase 2, a 4-month period, the pilot scheme will be launched for the updated CareFiji with telemedicine functions. The 10 most populated rural communities will be the focus of our pilot scheme, reaching out to 2,500 Fijians. Vending machines will be dispatched to these areas, and we will work closely with the Ministry of Health to supply the products sold. Personnel will be trained for both app and vending machine maintenance, which includes restocking prescription drugs and rapid antigen tests. In Phase 3, a 4-month period, feedback obtained from the pilot scheme will be used to refine the app design. All vending machines will be in operation, and advertisements will be sourced to sustain operation costs. In Phase 4, the final 10-month period, the officially updated CareFiji app will be launched to the public. In the long run, we aim to promote preventative healthcare and hygiene awareness via educational clips incorporated on the sides of vending machines. Furthermore, solar panels can be installed to generate sustainable energy. As for our budget of $200K, we will allocate $55.5K to buy vending machines and $100K for app development. We will set up 37 vending machines in total, with each costing $1.5K. And an additional $44.5K will be spent on training a specialized maintenance team, who will be traveling between islands for machine maintenance and drug restocking. We will also gain income from advertisements being shown on our vending machines for the long-term financial sustainability of the project.
Now, let's break down the possible challenges our team might face. Regarding the feasibility of promoting mandatory use of the CareFiji app, 95% of Fijians have access to the internet across 3G, 4G, and 4G Plus networks. Large telecommunication companies like Digital have launched satellite internet for remote areas, providing internet access to the remaining 5% of the population. It is anticipated that all Fijians will have internet connectivity shortly. Another challenge is incompatible mobile devices, especially within the elderly and low-income families. To allow smooth installation and running of CareFiji, we will collaborate with Oxfam, who runs a mobile phone donation program. Old phones donated from developed countries will be repaired, repackaged, and distributed to Fijians in need. In terms of allocating vending machines, our team must navigate the problem of Fiji's scattered rural population. To maximize our limited resources, rural communities that meet the following criteria can benefit from our vending machine program. As there is no standard urban-rural dichotomy, we have modified the World Bank's proposed operational definition of rural areas. Apart from considering the population density of inhabited islands, as well as the distance from main cities such as Suva, we take into account whether medical institutions are within walking distance or can be reached by inter-island boat trips within 15 minutes. In face of budget limitations, we can mitigate costs by seeking help from institutions. For instance, students from the National University of Fiji could be invited to provide help with mobile app development. In conclusion, rural areas in Fiji are a vulnerable population that need resources and support during a pandemic. For these remote areas, physical distance, limited accessibility to testing, and early case detection can be improved by modifying the existing CareFiji app and by installing medical vending machines. We hope that moving forward, the FIPHER project can enhance the current healthcare surveillance system and improve medical accessibility in Fiji.